This program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest UCTV programs.
Well, good morning, everybody. I want to thank you all for being here and participating in this annual colloquium. I also want to thank Karen and her staff for all the work that they put into organizing this. For those of you who don't know, Karen joined us in September of 2013. She came to us from the Moore Foundation, where she had been for 4 years as program director for the Moore Initiative in Nursing. In January of this year, she assumed the position of interim executive director and brings great strength and experience to the activities of the center, and we're pleased to have her as executive director. The topic of the colloquium is overcoming obstacles to spread. And what I want to do just briefly is to talk about some of the successes we've had in terms of spread vis-a-vis taking a system-wide approach to issues. And what I've indicated here is, despite the fact that we are a virtual system, that is, we're not organized as single systems, no single governance over all the health-related activities, the 17 health professional schools, the 5 medical centers with 10 hospitals. More and more, we have been doing things together as a system, as one, realizing the great value that brings to many, not all, but to many of our activities. It started probably 5 years ago with our contracting as a system with commercial insurers. We also do it now in our interactions with Medi-Cal, and it's been very successful for us. Negotiating the provider fee and the Medi-Cal waiver. We do as a single entity, all 5 medical centers working together. Purchasing of supplies, devices, that's roughly half of the pharmaceuticals and supplies that we purchase, in total roughly $500 million. We do centrally, working as one. Improving clinical performance, exemplified by this center. This center was established in 2011 in the context of, could we do something as a system, taking advantage of best practices that exist at 1 or 2 locations and spreading them throughout the whole system to improve the quality, the affordability, the safety of the care that we provide. And in my view, it has been enormously successful, learning from one another. We presently have an activity in Southern California where the three medical centers, San Diego, Irvine, and UCLA, are working together to develop a virtual single transfer center so that when patients are transferred from outside UC and they cannot be accommodated at, say, at Irvine, and they can be accommodated at San Diego or at UCLA, we make that arrangement. So rather than saying a single medical center, we can't take that patient for whatever reason, we canvass the other 2 medical centers to try to keep accommodate that person within UC. We went live with our self-insured program for our self-insured insurance program for our employees last year, called UC Care. That began January 1 of this year. We have 22,000 of our employees, and if you count employees independents, it's roughly 45,000 lives. In that insurance plan is the 3rd largest insurance plan that our employees choose. And again, we're doing that as a system. Recently, we've embarked on another activity, understanding that we have some financial challenges coming to us over the next several years, as we see reimbursement from both public payers and private payers diminishing, and our expenses need to diminish accordingly, so the revenue and the expense lines don't cross. So we have thought about over the past year of taking a system-wide approach to expense reduction. working with the CEOs of the medical centers, the deans of the School of Medicine, the chancellors of the 6 campuses that have health-related activities, critical regents, and most recently involving President Napolitano. And over the past several months, we've identified areas that we want to work on as a system to do expense reduction activities as a system to try to get our expenses under control so that we can continue to enjoy the financial success we have, which is not only important for capital replacement and replenishment and support of our medical centers, but also programmatic support of our medical schools. Remembering that our medical centers provide significant support year after year to programs in our medical schools and other entities outside the medical center. We've called this activity Leveraging Scale for Value. We presented an action plan to the President just prior to the Christmas holidays, which she approved. We then vetted that plan with the CEOs, deans, the CFOs, the chief operating officers. We had a follow-up meeting with the President, the regents, the chancellors at the end of February, and we reported on this to the regents at the March meeting. We have developed an organizational oversight group called the UC Health Shared Services Management Council to oversee activities in 3 areas to begin with: supply chain, revenue cycle, and clinical laboratories. And as a way to try to take a system-wide approach to leverage the scale that 5 medical centers bring to activities in this area. So this is just another example of taking a system-wide approach to an important issue. Now, I was reminded just prior to beginning the conference this morning that we do a lot of things as a system, and some are more important than others. And certainly, taking a system-wide approach to expense reduction is important. But I think you would agree with me that we don't necessarily want to be known as the best system in the country in terms of supply chain, or the best system in the country in terms of revenue cycle. But we do want to be known as the best system in the country in terms of providing more affordable, accessible, higher quality, safe health care to the populations that we care for. So that's why this conference is so important, because it is an example of a system-wide approach, learning on best practices, spreading best practices throughout the system so that we can truly be a system renowned for coming together to do the right thing for the patients we serve.